This combination medication is used to treat symptoms caused by the common cold, flu, allergies, hay fever, or other breathing illnesses such as sinusitis and bronchitis. Dextromethorphan is a cough suppressant that affects a certain part of the brain, reducing the urge to cough. Decongestants help relieve stuffy nose symptoms, and antihistamines relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Some products are not recommended for use in children younger than 12 years. Always ask your doctor or pharmacist for more details about using your product safely. Remember that these products do not cure or shorten the length of the common cold. To decrease the risk for serious side effects, carefully follow all dosage directions and do not use this product to make a child sleepy. Be sure to consult with a doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Glentuss, it's important to follow the directions on the product package or as directed by your doctor. You can take it with or without food, and with a full glass of water. If you're using the liquid form, make sure to measure the prescribed dose carefully with a medication measuring device. Don't use a household spoon. For extended-release capsules, swallow them whole and do not crush or chew them. If you're taking the chewable form, chew it thoroughly before swallowing. The dosage of Glentuss is based on your age, medical condition, and how you respond to the treatment. If you're using it for allergy or hay fever symptoms, take it regularly to get the most benefit from it. It's important not to misuse this medication, as it can result in serious harm. Make sure to not increase your dose, take it more often, or use it for a longer time than directed. And if your condition doesn't improve or gets worse, be sure to tell your doctor. Some common side effects of Glentuss may include drowsiness, dizziness, headache, blurred vision, upset stomach, nausea, constipation, or dry mouth/nose/throat. To relieve dry mouth, you can suck on sugarless, hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. It is important to drink plenty of fluids unless otherwise directed by your doctor to prevent the medication from drying up and thickening mucus in your lungs. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. If your doctor has prescribed this medication, they have determined that the benefit to you is greater than the risk of side effects. Some serious side effects may include mental/mood changes, ringing in the ears, shaking, trouble urinating, weakness, easy bruising/bleeding, fast/slow/irregular heartbeat, or seizure. A serious allergic reaction is rare, but seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. Remember that this is not a complete list of possible side effects, and it's important to contact your doctor or pharmacist if you notice any other effects. Always consult your doctor for medical advice about side effects. It's important to talk to your doctor or pharmacist before taking Glentuss if you have any allergies or medical conditions. This medication can cause dizziness, drowsiness, or blurred vision, especially in older adults. It's important to be cautious if you have diabetes, alcohol dependence, or liver disease, as the liquid form of this medication may contain sugar and/or alcohol. Before having surgery, make sure to inform your doctor or dentist about all the medications you are taking. Additionally, if you are pregnant or breastfeeding, it's crucial to discuss the risks and benefits of taking Glentuss with your healthcare provider. It's important to be aware that Glentuss may interact with other medications, potentially changing how they work or increasing the risk of serious side effects. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Taking certain MAO inhibitors with this medication may cause a serious, possibly fatal drug interaction. It's important to avoid taking specific medications during treatment with Glentuss, and most MAO inhibitors should not be taken for 2 weeks before and after treatment with this medication. It's best to ask your doctor for guidance on when to start or stop taking this medication. Additionally, there are some products that may interact with Glentuss, such as antihistamines applied to the skin and rolapitant. It's important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, and to check the labels on all your medicines because they may contain ingredients that cause drowsiness. Furthermore, Glentuss may interfere with certain medical or lab tests, potentially causing false test results. It's important to make sure that lab personnel and all your doctors are aware that you are using this drug. Remember, always consult with your healthcare provider before making any changes to your medication. If someone has taken too much Glentuss and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include agitation, confusion, flushing, hallucinations, large pupils, muscle twitching, and seizures. In children, excitement may occur first, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. Always seek professional help in the case of an overdose. If your doctor has prescribed Glentuss, do not share it with others. Make sure to keep all medical and lab appointments to monitor your progress and any side effects. It's important to follow your doctor's instructions for the best results. Glentuss is used to treat coughs caused by the common cold, bronchitis, and other breathing illnesses. It helps to relieve coughing by decreasing the activity in the part of the brain that causes coughing. Take Glentuss by mouth with or without food, usually every 4 to 6 hours as needed, or as directed by your doctor. Use a medication measuring device to carefully measure the prescribed dose. Do not use a household spoon. If you are using the liquid form of this medication, carefully measure the dose using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. If you are taking Glentuss on a regular schedule and forget to take a dose, take it as soon as you remember. If it is close to the time of your next dose, just skip the missed one and take your next dose at the regular time. Do not take double the dose to make up for the missed one. When storing Glentuss, make sure to keep it at room temperature and away from light and moisture. It's important not to store it in the bathroom or freeze the liquid forms of this medication. And always keep all medications out of reach of children and pets. When it comes to getting rid of expired or unused Glentuss, it's best not to flush it down the toilet or pour it into the drain unless specifically instructed to do so. Instead, it's recommended to properly discard this product by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.